HRCT chest. Clinical info. COVID positive. Mild cough. Technique. 0.5 mm reconstructed images from a scan performed on multi-slice CT reviewed on workstation using different window and level settings. Non-contrast HRCT scan is performed. Findings. There is bilateral multifocal patchy dense ground glass attenuation and ground glass nodules with superimposed inter- and intralobular septal thickening. Findings are predominantly seen in peripheral, subpleural and posterior basal distribution. Associated mild bronchial and vascular dilatation is seen. There are few thin subpleural bands and atelectasis. No segmental collapse, pleural effusion or pneumothorax is seen. Following lung segments are involved. Right upper lobe. Apical segment less than 50% involvement equals 0.1 score. Anterior segment less than 50% involvement equals 0.1 score. Posterior segment less than 50% involvement equals 0.1 score. Right middle lobe. Lateral segment less than 50% involvement equals 0.1 score. Medial segment less than 50% involvement equals 0.1 score. Right lower lobe. Superior segment less than 50% involvement equals 0.1 score. Anterior segment has no involvement equals 0.0 score. Lateral basal segment has no involvement equals 0.0 score. Medial basal segment has no involvement equals 0.0 score. Posterior basal segment less than 50% involvement equals 0.1 score. Left upper lobe. Apical segment less than 50% involvement equals 0.1 score. Anterior segment less than 50% involvement equals 0.1 score. Posterior segment less than 50% involvement equals 0.1 score. Superior lingular segment less than 50% involvement equals 0.1 score. Inferior lingular segment less than 50% involvement equals 0.1 score. Left lower lobe. Superior segment greater than 50% involvement equals 0.2 score. Anterior segment less than 50% involvement equals 0.1 score. Lateral basal segment less than 50% involvement equals 0.1 score. Medial basal segment less than 50% involvement equals 0.1 score. Posterior basal segment greater than 50% involvement equals 0.2 score. Thyroid is normal. Few prominent but sub-centimeter calcified mediastinal lymph nodes are seen. There is no definite mediastinal, axillary or supraclavicular lymphadenopathy. Atherosclerotic calcifications are seen in aorta and its major branches. Heart, rest of great mediastinal vessels, esophagus and tracheobronchial tree do not show any abnormality. There is no pericardial effusion. GE junction is collapsed. There is suggestion of a small hiatal hernia. In visualized upper abdomen, status post-cholecystectomy is noted. Liver shows diffuse fat attenuation. There are two ill-defined hypodense lesions of fluid density in segment V, -6 to -4 Hu, likely cyst. Few bilateral renal cysts are seen. Largest one at interpolar region of left kidney measures 23 mm. Few of these cysts show benign calcifications. Rest of visualized viscera and bowel loops remain unremarkable within the confines of non-contrast examination. Age-related degenerative changes are seen in visualized spine. There is no aggressive osseous lesion. Impression. Multifocal patchy subsegmental ground glass attenuation and large ground glass nodules with superimposed inter- and intralobular septal thickening involving bilateral lungs, predominantly in peripheral and subpleural distribution. Findings are consistent with patient's known diagnosis of COVID-19 pneumonia, CORADS6, with CT severity index of 19/40. Severe corresponds to more than 19.5/40.